As South Africa faces the onslaught of a second wave of COVID-19 infections, there are horrific reports emerging of hospitals in both the private and the public sector simply battling to cope with massive shortages of oxygen, among other problems. I want to introduce you now to Rinesh Chetty, a specialist orthopaedic surgeon in KwaZulu-Natal. He's quoted as saying, "The surge of infections has broken the back of efforts to keep the pandemic at bay." Dr. Chetty, good afternoon to you. I'm hoping that you've been quoted correctly, because that is a very serious indictment. You're someone who is on the front line of this virus. How has the back been broken?
Jeremy, thank you for having me. You know, the reports, there's a lot of talk, there's a lot of horrific stories that are going around. You know, and we don't need to look far, and we don't need to ask a lot of people in anywhere around here in Durban or KZN that hasn't been directly affected by this virus as of the middle of December. In terms of breaking the back of us, keeping the pandemic at bay, we were able to control the small bushfires, the small outbreaks of the virus, and we were able to control the few COVID infections that were coming in through most of the hospitals. When I say break the back, it means that we've basically been inundated with mass amounts of patients. You know, I was criticized a bit for spreading panic, and I don't think I was spreading panic. I think the most important thing is that people need resolve. People need to understand that the numbers that are coming through at the moment, this is no time to panic. This is a time for us to be properly unified. We need to be disciplined. We all need to take responsibility for ourselves and those around us. And, you know, if you look at history and if you look through the current stats at the moment, the countries that have done well, the countries that have held the pandemic at bay, the countries that have worked to find the sort of cure, in inverted commas, have all had discipline, have all listened to protocols, have followed the government and all the research, and they've worked together. South Africa needs to work together if we're going to help this. Everybody's looking towards the vaccine. I hope and I pray the vaccine works, but it's going to take some time. Whether it takes a few days, whether it takes a few weeks, whether it takes a few months, we need help now, and South Africa needs to help each other. South Africans need to help each other.
Dr. Chetty, it's a fact that doctors, not only in KwaZulu-Natal but around the country, are suffering from burnout. What is the impact of that?
The impact's been immeasurable. I mean, it's so difficult to keep motivation personally and with other people. But as I said, you know, when I drive to work and I see every person wearing a mask, I see people trying to do their best in social distance. I see these reports and these messages and these things that the public have sent us. I mean, just today we've had a delivery of chocolates. We've had some bottled water sent across to our staff downstairs. It makes such an amazing difference. We need everybody to really band together. The burnout is a major problem. There's a lot of protocols and staff that are helping each other. We're losing staff, we're losing doctors, we're losing nurses, paramedics. Our loved ones are going, and we need help. We need manpower. I made a comment about there being emergency policies. The government needs to make some policies through. We need to bring through volunteers. The main thing is the manpower. It's not about beds. Everybody thinks that the bed needs to be there, but somebody has to man those beds. It's okay having 10 million ventilators, but we need staff. We need manpower, and we need everybody to help.
Is the reality, though, Dr. Chetty, that staff that you're making an impassioned call for today are simply not there because we are so overstretched?
We are. We need hands. We've got the intellect, we've got the brain, we've got the experience, we've got doctors, we've got nurses. We need hands. And I think it's time that we stop beating around the bush. We stop trying to leave it all at the doorstep of frontline workers and doctors and nurses and paramedics. And people need to start helping. How it's done, I've had so many people offer. That's why I'm saying the powers that be need to make emergency laws, emergency policies, and really just help doctors. It's the saddest thing when the first thing we're thinking about is well, what are the legal implications of doing this? What are the legal implications of trying to go all out to help these patients? Because we're worried about litigation, we're worried about this. It's always been a problem. And right now, we desperate times call for desperate measures. And the manpower is the main thing we need. And how it gets done, it needs to be done. South Africa needs it done, we need it done, and everybody needs to put their thinking caps on now.
Dr. Chetty, of course, the conundrum that you would face and health authorities is that a tired doctor can also make bad decisions.
This is why I'm saying that we need all the helps, all the help we can get. We've been tired even before COVID. We've been tired even before anything else like a pandemic. The one thing the pandemic has shown, and the one thing that the pandemic has shown across the world in every healthcare setup, is it's shown the deficiencies of what that healthcare system is running at. And we've had historical deficiencies, whether you're looking at public or private. And this is a way for everybody, public, families, politicians, policymakers, to see the deficiencies and try and fix it right now. We need help.
Dr. Chetty, how are you coping?
I'm trying my hardest. I'm an orthopedic surgeon. I'm a spinal orthopedic surgeon. I've closed my practice down. I've tried to help every single one of my nurses, every single one of my staff members. It's getting tough out there. But, you know, I find just the presence of having people around and making sure everybody's well hydrated and motivated. We've got to do this. It's getting closer and closer to home, and I'm signing off colleagues' death certificates, and we just need to really work together. South Africa needs to understand. Forget the holidays. Forget everything else. Everybody needs to sit together. Everybody needs to work together, and forget about profits. Forget about anything else. If we want to see the end of this, we need discipline. We need focus, and we need motivation and concentration. That's the only cure. That's the only vaccine we have right now, is each other and our unity.
Straight from the heart. Thank you for talking to us, Dr. Rinesh Chetty.